As the nationwide strike by the National Association of Resident Doctors, NARD, enters its third day, operations at the Federal Teaching Hospital, Katsina, have been severely disrupted. The state's largest referral hospital is currently offering only critical services at the Accident and Emergency Unit, Intensive Care Unit, Paediatric Ward, Maternity Unit, and Dialysis Centre, while other departments remain shut down. This development has forced hundreds of patients to vacate the hospital, worsening their conditions, heightening caregivers' frustrations, and overburdening the few health personnel still on duty. Abdullahi Yamadi has more on that.
The usually bustling hospital now wears a deserted look. Areas that were once crowded, such as the outpatient department (OPD) and laboratories, stand empty. Even in the few units still functioning, most patients have been evacuated, leaving behind deserted wards and corridors. The ongoing NARD strike has plunged patients and caregivers into untold hardship, with many passionately appealing for urgent government intervention.
The situation here is pathetic. Many patients evacuated from this facility cannot afford treatment at private hospitals. We sincerely appeal to the federal government to address the root causes of this strike and rescue the patients. Many patients who left the hospital are now lying helplessly at home in severe pain with no place to turn for help. Something urgent needs to be done. Resolving this crisis without further delay is the only option.
We have witnessed patients dying here since the strike began about 3 days ago due to lack of adequate care. This calls for immediate action by the federal government to end this unfortunate situation. Although the strike is still ongoing, the hospital has made arrangements to care for patients with critical conditions. As you can see, our patient is gradually recuperating. The Federal Teaching Hospital, Katsina, which has about 400 resident doctors, now depends on barely 100 consultants, along with a few nurses and health workers handling only emergency cases. Health personnel say they are overstretched and have been forced to refer patients to state-owned facilities like Ture Eradua Hospital for continued care.
So while we still admit those children that are critically ill, we still admit them and manage them. Those ones that go beyond at least what we can cope with, we'll try and stabilize and then refer to where they can get better services for now. So but it is, we are trying as much as possible to ensure that we will maintain the service. It's not easy.
Even this now we have 3 admissions. Yes, 2 from the MASF, referral from the MASF. So one is from Mudru. The diagnosis is a suspected diphtheria. So now they are admitted. So that's what I can say in terms of this strike nationwide.
In a swift response, the Chief Medical Director CMD of the hospital, Dr. Nasir Aliu, called for coordinated efforts to resolve the strike, assuring that management is working round the clock to sustain critical operations.
We try as much as possible. The consultants are working hard to see that critical patients are still attended to. As you know, we have a lot of patients undergoing dialysis. All these services are still available. We are the only center in Katsina State that have functional special care baby units. When you go around, you see that all these units are still functioning. But I can't tell you that they are functioning up to optimal. But we are doubling the effort with the hope that this impasse can, within the shortest possible time, be overcome. I know the government is seriously engaging the NARD members, and they have shown a lot of commitments. I know almost everybody has received a lot of arrears for almost 4 months, including myself, because I'm a worker of the hospital.
Despite his optimism, Dr. Aliu acknowledged that only prompt action from the federal government can restore full medical services and bring relief to the hundreds of patients affected by the strike. Abdullahi Ismayamadi, Trust Television News, Katsina.